Hello everyone, how's it going? Addiction can have a seriously negative impact on a person's life. Well, what causes addictions? What treatments are available? And is this something that only affects young people? Or could older adults be vulnerable? Well, if that sounds interesting to you, then keep watching. Now, addiction has two main forms. There are substance use disorders and behavioral addictions. Addiction is a chronic condition that involves compulsive seeking and taking of a substance or performing of an activity despite negative or harmful consequences. Now, is this a young person's disease, or are there some ways that an older adults could be vulnerable to addiction? Well, we're going to talk about that in a few minutes, but first let's talk about what causes addiction and what treatments are available. Now, the American Society of Addiction Medicine defines addiction as a chronic brain disorder. Your brain chemistry actually changes with addiction. Now, some substances that have addiction potential are alcohol, caffeine, cannabis, hallucinogens like PCP, LSD, hypnotics, sedatives, anti-anxiety drugs, which are sometimes prescribed to help people sleep, benzodiazepines and barbiturates. There are also inhalants like paint thinners, aerosol sprays, gases, and nitrites. There are prescription and non-prescription opioids like codeine, oxycodone, and heroin. There are also prescription and non-prescription stimulants such as Adderall, cocaine, and methamphetamine. Tobacco and nicotine we know are highly addictive, so people who smoke cigarettes or electronic cigarettes or vaping could be at risk for addiction. Now, we have to remember that this is a potential when it comes to these substances. It's not always going to lead to addiction. Substance use disorder can actually be mild, moderate, or severe. And there's not a single cause when it comes to addiction. It's a very complex condition. There are certain factors that could make a person more vulnerable, such as if you have a sibling or a parent with a substance use disorder, if you have mental health issues, if you have environmental factors could also play a role. So if you have more easy access to substances, or if you had to deal with stressful or traumatic events during childhood, that could also make you more vulnerable. Now, some examples of things that could become addictive behaviors are gambling, eating, exercise or dieting, shopping, shoplifting, other risky behavior, having sex, viewing pornography, video gaming, and using the internet. Now, certain substances and behaviors can affect the reward center of the brain. The body releases dopamine, which makes you feel pleasure. Now, this can come from healthy behaviors like spending time with loved ones or enjoying a delicious meal. But when it comes to unhealthy substances and behaviors, a person may experience massive dopamine levels. And this can have a damaging effect on their thoughts, feelings, and behaviors. This can actually cause a person to have an unhealthy drive to seek more pleasure from these unhealthy substances or activities and less from healthier activities. Over time, a person can become desensitized and they need more of the substances or activity to produce the same effect, like an effect of a feeling of euphoria. Now, if the person tries to stop, they experience withdrawal, which can include physical symptoms like shaking, sweating, or vomiting, and they may become anxious or irritable. Having these addictions can actually lead to personal problems, physical and mental health issues, problems at work, problems with relationships, and it can even lead to legal and financial difficulties. Well, despite these detrimental effects, a person finds that they just can't stop. Now, the good news is that with treatment, many people have been able to manage their addiction and actually live full, healthy lives. Well, what treatments are available? Well, before we move into that, I'd like to remind you to please like and subscribe if you're enjoying today's information. Also, make sure you always check out the links below in the description box where you can read more information on this topic. And feel free to leave a comment below if you have something you'd like to share on this topic. Something that you say in your comment may be something that could really encourage somebody to get on the road to recovery. So what treatments are available? Well, when it comes to certain substances, withdrawal can be dangerous, so hospital management might be the best option. But also there are medications that can be prescribed that can reduce cravings, urges, and withdrawal symptoms. There are also medications that could help with mental health conditions like bipolar and depression, which sometimes may have been a contributing factor to why the addiction started. There are also rehabilitation programs and facilities where you can receive structured counseling, education, support, and encouragement. And oftentimes they will give you the option to be an inpatient or outpatient. There's therapy that's helped many people with addiction, such as cognitive behavioral therapy. There's also group therapy, and many people find it helpful to join a support group. That way they can have a chance to share their experience and find ongoing support. I'm going to leave a link below. You can check out that link that can help you to find some resources that may help. Well, what about older adults? Well, death rates from drug overdoses among people 65 and over have more than tripled over the past 2 decades, and a significant increase is being seen in the number of older adults needing treatment for substance use disorder. Now, as with younger people, alcohol is the most common substance use disorder. But when it comes to many older adults, they're dealing with multiple health issues and possibly pain. So it's more likely that they're going to be prescribed more medications and be dealing with drug interactions. Also, they're more susceptible to the effects of drugs with age. As we get older, we can't absorb and break down drugs and alcohol as we could when we were younger. Also, older adults may be more susceptible to addiction because of social isolation, dealing with grief and loss, a change in their residence, and even mental health issues. Now, it's encouraging to note that help is out there and that you don't have to face recovery alone. Addictions are treatable. Now, if you've started treatment, don't get discouraged if you have setbacks. And when it comes to treatment options, evidence shows that a person's commitment to change is more important than the treatment chosen. But I'm going to leave a link in the description box below to the Substance Abuse and Mental Health Services Administration. It's also called SAMHSA, and it's actually a treatment referral service, and that referral service is free. Now, if you don't have insurance or you're underinsured, they will refer you to your state office, which is responsible for state-funded treatment programs. So you can find out about that by checking out their website, and I'll also leave their phone number down there in the description box. Now, according to the CDC, addiction can happen to anyone. The good news is that there are safe and effective ways to recover. And so if you or a loved one are dealing with addiction, you want to check out the link below that I was talking about, because getting the help you need for you or your loved one could be a great start helping you to get onto your road to recovery. Well, I hope you've enjoyed today's information, and I hope to see you in the next video where we'll discuss another way we can improve our health.